When you have a challenge, do not recall back. Look at what you have learned from that challenge, and see how you can use that to improve in what you do.
That is a snippet of our podcast today. Hello and welcome to Lead to Excel podcast, where every story sparks inspiration and every conversation brings you closer to your best self. I'm Maureen Chiana, and I'm here to explore the extraordinary fusion of leadership, emotional intelligence, and the groundbreaking insights of neuroscience. Whether you're leading a team, building a dream, or simply on a quest for personal growth, you're in the right place. So let's dive in and transform the way we think, lead, and live. Welcome aboard. I am so excited to be back with another episode of Lead to Excel podcast. I am actually smiling because I am with a very, very good friend of mine. She's a friend, she's a sister, and we've known each other for a lot of years. So today, I'm so honored to have Dr. Njide Okonjo-Udochi with us today. Dr. Njide, thank you for coming on to Lead to Excel podcast.
Oh, I'm so excited to be here. I'm really happy to be able to be on this podcast and to share, whatever knowledge that I have. It's so nice to be with someone who is not just a friend, but actually a sister. We go back so many years.
Many years. We've known each other since we were very young. So it's such an honor to have you on the podcast today. And it's something I've wanted to do. And I think I did mention it to you a few years ago that we've got to get onto the podcast. And that's really because, Njide, I've seen so much of what you do. You do so much in your medical profession and outside your medical profession. And I want us to really talk about it today. But let us go back a bit to growing up. Kind of grew up, I think it was in Ghana. And then,
yes.
Take us back a bit. How was it growing up as a young girl in Ghana, Nigeria? Tell us a bit about that.
A lot of people ask me that, how was it growing up? I think it was just what actually shaped me, the life experiences that I had, the parents that I had, growing up with two academics. Both my parents were professors. My dad worked for the United Nations, and we lived, first of all, in Nsukka. My dad worked in the Department of Economics and my mom in the Department of Sociology. And living in a university community, that shapes you, and really, you're surrounded by a lot of, intellectual people who just, you can't help, learning from them, and imbibing, their values. And then from there, I remember we had Professor Chino Achebe, people that you hear about now, legends, and luminaries that you hear and people look up to, talking and visiting our homes and influencing our upbringing. In those days, it's not like now, you have to be very careful. But and then from there, we moved to Ghana, and I was also in a university community. Even though my father worked for the United Nations, he loved being challenged academically. So he loved the university community. So I grew up at the University of Ghana and actually learned how to speak Twi and Ga, which are two languages in Ghana. And growing up then, it taught me to be able to be flexible, to meet people from different parts of the world. A lot of my dad's colleagues were from all over the world, Bangladesh, India, different parts of Africa, the US, and so on. And so and then you grew up with their kids. So plus we had a lot of our Ghanaian friends in school. It just taught you to be able to be flexible and to, embrace people for who they are. And it also showed us that everybody is the same. We all want the same things. It doesn't matter where you're from. We have the same values, going into different people's homes, our friends at that time. What my father was telling me was what their parents were telling them. So friends from all over. And then, so I think for us as children, it really shaped us, the ability to love anybody. It doesn't matter where they're from, and to learn that we are all the same and to be respectful of people no matter what. So I would say, and my sister and I like to say, and my other siblings, that we're detribalized or denationalized. We just love people for who they are.
Yeah. And that actually comes out in the way you live as well. And still back in when we're young, I want to ask you a question, because I remember when we were young at school, you were one person, because we were actually in the same class, and you were so studious. I will look at Njide studying so much, and I will go, I should be doing this. But, I'm going to confess, true confession here, I wasn't very good at doing that. So, Njide, what was driving you at that age? What was it that made you, because it's almost like you were so focused. You knew what you wanted and you were so determined. How did you, what was it? How did that come about? Or what was the thought process at that time?
A lot of people ask me that because I've always been, like really focused and really studious. I think part of it is just my parents. Both my parents were professors. They expected the best from us and they demanded excellence. And being, my father's child, my mom's child, they really gave us goals. Before you went to school, there was a goal. You had to be, nobody had to be in any class. You had to work hard. My dad told us, he would always talk about the Biafran War and how they lost everything and how he built up from that to where he is today. And, and he would tell us to just not look at the immediate, attractions of being a child, but to think about the future and what you want to become. And the only way to do that was to work hard and be focused, not follower, and he believed so much in the power of academics and that excelling will get you to wherever. And my dad would say, it's not okay for you to be the best in one subject. You have to be the best in every subject. You have to, if somebody has 1 degree, you have to get 3, so that when it comes to time, to succeed, or to excel or to be chosen for something, you will be the one that is chosen. He was obsessed with, being successful and education. And he believed in the power of working hard and being focused, even at an early age. So he instilled that in me. And I just think, I looked up to my parents. I saw the kind of, the values they had and the way they behaved. They were very hardworking people. And so I just copied what I saw, I just, was emulating what I saw at home. And I knew that in order for me to be successful, I had to work hard and I couldn't be distracted by whatever was going on in school at the time. I know it seems cliche, but honestly, at that early age, that's all I wanted to do. I knew I had to do work and excel, and there was no other way but to study.
That's amazing. That's amazing. And I like what you've said in terms of you go back to school with goals, and that's so important. And you can see the impact it's had on all of you. The way you were brought up and the impact it's had on how you've all turned out. And that's really incredible. And it's something that people don't even realize, that as your parents were driving you to excellence or for excellence, it was wiring your brain to be that focused, to be excellent, so that because honestly, I remember you, and it was excellence. You always went for excellence. You were very studious. You knew why you were there, and you focused on that. And I could see it even play out in your life as an adult as well. So that's, I think for us as parents or for young parents growing up, this is a big lesson. Whatever you sow into your kids, will determine what they become tomorrow. So it's so important. Those goals you set, what you tell them, your expectations of them really makes a difference. Thank you so much for sharing that with us. And it's amazing. Your incredible parents are truly incredible, honestly. So, Njide, what made you decide to study medicine? Why medicine specifically?
Actually, I love art. Anyone who knows me knows that I love art. You can see behind me, I have a painting.
Because your house, yes.
I'm obsessed with art. So I'm a very creative person. I like decorating. And I really thought I was going to do architecture because I loved art and interior design. But that's just and if you remember in school, we had an art class and I was always there with the teacher. And, I just love creativity and that. So, but I was really hard. I was very good in science. And my mom kept on telling me, you're good in science, you should be a doctor, and in those days, it's not. Now you tell kids, do this, and they're like, no, I want to do whatever. Because I looked up to my parents, they would say, you need to be a physician, you need to be a physician. And I said, okay, and then in school at Queen's College, Lagos, we had a school guidance counselor. And I went up to them and I said, my parents want me to be a doctor. And they said, yeah, you're very smart. You should do medicine. So that's actually what got me interested. I wasn't like, my father wasn't a physician, neither was my mom. They were both academics, but I started, exploring it even more myself, reading up, more about medicine and biology and so on. And I found out that I loved it. It was like a novel. So I said, okay, I'm going to try this. And that's actually how I got myself into medicine. And then I applied to go to medical school, in Nigeria. And then, I got in and the rest is history.
So now I want you to tell us about this history. So can you just tell us briefly who Njide is? What do you do? Because I know you're the CEO of Summit Medical Group. And I know you had a practice, general practice before that. So can you tell us a bit about what you do at the moment?
Yeah. So yes, I'm a family physician. I'm also a geriatrician. I like to say that because even though I'm a family doctor, I did a fellowship in geriatrics because of my dad. He was a statistician and he insisted that because of the way the statistics was working out, if I was going to be in the United States, I needed to do a fellowship in geriatrics. Geriatrics is really about taking care of older people. So I specialize in that. But, following that, I did work for Mercy Medical Center after my residency and fellowship. I got married. I had little kids, and I needed a job that would combine preventive medicine, clinical medicine, and give me time to be able to raise my young family. So at that time, I decided to look for a public health job, a job that combined both public health work as well as clinical work. And I was hired by Mercy Medical Center to run the Healthcare for the Homeless program in Baltimore City. And that was so rewarding because I was able to blend my public health experience and my clinical practice as the medical director for Healthcare for the Homeless. This was one of the most rewarding experiences in my career because it was during the time of the AIDS epidemic, and I was just there. And if you think back then, there was a big outbreak of an epidemic also of drug substance abuse. So I got involved in addiction medicine, HIV medicine, in order to be able to actually take care of these patients. So working with the homeless, it really inspired me because you had to create a new system for them. Who wants to take care of homeless patients, without having, a holistic approach to it. You had to bring in specialists because a lot of them had needs that were far more than primary care doctors could do. You needed social workers, you needed addiction counselors, and basically you had to create a home for them. So that enabled me to create what I call a patient-centered medical home, aligning other specialists to us, so that there were people who could come into the practice, deal with their mental health issues. We had psychiatrists, we had social workers, we had addiction counselors. And I saw how the outcomes were just phenomenal. The patients who came in, the homeless patients, did so much better because they had all their care in one space, including the specialty care, and we had people who were referring to who had the same vision and goals and who really saw the mission of what we're trying to do and create a healthcare for the homeless. So with that in mind, after several years of working there, I decided to start my own practice. That's how I found Millennium Family Practice, which was a solo private practice, which I had for several years. And then, of course, when my son became a physician and he decided to do internal medicine, I enticed him into being a primary care doctor to continue the kind of work that I was doing. And because it's so rewarding to be able to take care of people right to you, where the gatekeepers of medicine, as they say. He did internal medicine. And so he was a different specialty. And I wanted to see how I could expand my practice and get other people involved into the same kind of model of care that I had used that was so successful previously at Healthcare for the Homeless. So in creating Summit Medical Group, it's what I like to call my own patient-centered medical home that has other physicians. So we have other physicians in our practice. We have psychiatric nurse practitioners. We have a nutritionist. We have therapists. So the whole idea is to have care in one space. And that necessitated the importance of having a building where people could be in, and the specialists could also be in the same space to enable patients be more compliant, to make it easier for them to access specialty care and access services. So we have lab work there, we have other specialists there, we have a pharmacy. So it's in creating this more care that enabled me to, actually go out and show that when you actually have a vision, that you can accomplish it, and improve healthcare for the population that you're serving. For the population that we serve, it's mostly minorities and immigrants, and so that population, as you can see, they have so many challenges with social determinants of health. And so having everything in one space makes it easier for compliance, and helps them, achieve the goals that they have to do as far as their healthcare is. And it has been, really a blessing for us to be able to do this and help demonstrate that even minorities, you can improve their health indices and their health outcomes, by, having care that is more of a holistic approach, and care that recognizes the challenges they face, and you address those challenges for them, they can do very well. So that's. So I'm the CEO of Summit Medical Group, and I'm just blessed to have an incredible, support staff. The providers that we have are very, very, very bought into the vision of what we're doing. It's a mission to be able to help this population and to actually move the needle in improving health outcomes for this population here in the United States.
That's incredible. That's amazing. And I love the fact that it's almost like a one-stop shop, one place where everyone comes. What has been the challenge, though, for you in terms of navigating this route? Because one of the things you talked about was when you were working with HIV, mental health. And I know it's rewarding, but what were the challenges you faced in terms of working with homeless people, people with HIV in the 90s? How did you find that? And How has that helped, or how did that help you in terms of, later, or after you left that aspect?
So, what I learned, there's nothing more valuable than actually being there, being part of the solution. Everybody, if you think back, you see it was a very challenging time during the HIV epidemic. But one of the things I learned is that you have to individualize care. You have guidelines. But when patients are people, everybody is different, and you can take the guidelines and, you make it and fashion it to that particular patient. So we would use different regimens, what we call a heart therapy. I would create different regimens for the patients so that they would do better. Still being aware of what the guidelines were. So that was one of the things I learned. And also I learned that it's so important to involve other people, to collaborate. It's very challenging to deal with this population. You can't do it alone. And I am so happy because when I went to get my MBA and I went back to Cornell to learn more about the business of medicine and health policy, because you get to a certain point in your life, you have to know about how to survive as an entity, an organization, a business, and also what policy drives it, what I call the political determinants of health. What are those policies that drive the industry that you're in, and how can you influence that? So going back to Cornell, it really reinforced what my belief was, that you have to know, that teamwork, collaboration is the way to go. And I was doing this during the COVID pandemic. And the lessons that I learned during the HIV epidemic came to play for us, because at that time we had a core group of providers in the city. And it was those same providers that I called together to say, look, we have this pandemic. We need to work together to make sure we're saving people's lives. And so we formed that WhatsApp group. We were learning from each other, looking and seeing what providers were doing, other physicians were doing in China, in Europe, in the United Kingdom, in Italy. We're learning from that to try to use those lessons to also help our patients here in the United States. So all that, if COVID didn't teach us anything, it taught us that you have to work together. You have to collaborate to go far. It's not a competition. Collaboration wins over competition. And I say this a lot to people. We can all win. It doesn't have to be just you being successful. Bring others in, work with other people around you. And that's the policy and the way that I've done my work over the years. I like to say that there are enough patients for everybody, and we need doctors of all stripes and in all specialties. So there's no need to fight over patient turf or anything like that. I can have any primary care doctor move next to me. There are patients who want to see that kind of physician and patients who want to see us. So And because of that, it's, the lessons that taught me and what we did during the COVID pandemic that saved a lot of people's lives show that it is so important to have other people with you as you try to implement change, and to have other people with you as you try to reach a larger population, your larger community. If you want to have an impact, and have an impact that is outstanding, you have to bring others, because you don't know it all. It's so interesting when you have other people and you're collaborating, how those people, the other group or the other company, what they bring, their expertise, just talking with them changes the direction and actually moves the needle even farther than you would think. So I believe in the power of collaboration, with other people. So that's what it's really taught me. And so that is, the premise with which I run my business, is the premise with which, I do all the things that I do now, and in trying to look for people who will work with us to improve healthcare, not only here in the United States, because now with technology, and we know now we have digital technology, we can even expand care into Africa and help our continent, which I love so much, to help the providers there, through, using digital technology, doing second opinion consults, so to improve, the care that is being provided there. There are a lot of challenges in Nigeria and other African countries, and also to find a way to, employ the youth. I know that there's so many challenges we have here with human resources. And one of the things that I've been doing in one of my projects is actually working with an organization, Center for Social Awareness, Advocacy and Ethics. I'm blending, forming a trifecta of companies, Summit Medical Group with them, with CSAE, as well as First Patient Engagement, 3 of us coming together to make sure that youth are trained in Nigeria, and that the youth are also trained in and able to work. We offer employment to this youth so that they can support practices here in the U.S. remotely. And that is how my the organization that we have, our group, has been working, because this youth, they're really, really skilled. And I'm telling you, if you look at what the Nigerian youth, how talented they are, even with the limited resources, it will blow your mind. So I have a lot of them, helping our practice the front office as well as in back office, things like acting as virtual assistants, helping with answering the phones, medical receptionist. These are opportunities that now exist that didn't exist before we had digital technology, right? Yeah, and they also help alleviate the work that we do. So there's a center in Apapa that houses, these employees, and
so
working together.
Them with accommodation.
Yes, there's accommodation. There's also we're digital center. Yes, okay. A call center where they go to, and it's all secure, HIPAA compliant, and working with First Patient Engagement and us, we've been able to demonstrate this, and we're actually planning to scale this across the United States to different physicians, and practices all over the U.S., and beyond. So it just shows that once you work with other people, you can put like minds together and do something that has a positive impact. It will help youth unemployment in Nigeria, provide them with money because they get paid for the work they do. It helps. It's a win-win situation. It helps the physicians here in the U.S. run their practices even better, and those same youth can also be trained there's so many other aspects of medicine. In terms of front and back office jobs that they can do that actually helps a practice move forward and helps the workflow.
Gosh, Njide, this is just incredible. And I think I'm listening to you, and I think one thing that really comes through is your passion. Your passion for what you do really always comes through. And I want to ask you a question about you before I come back to the business again. Your parents were academics. Where did you get your business acumen from? Because you just did an MBA recently. So your business acumen has been way back. Where did that come from? How did that develop? Because I just see how you, even listening to you speaking, the way you're very visionary about what you do. And it's incredible. And the key thing, another thing that really comes through is the confidence to collaborate, because a lot of leaders shy away from collaboration out of fear of competition, but you actually embrace it. And that is a skill of a great business person and a confident person. So where did this come from? When did you notice, or how did you nurture yourself to be like that?
The word that they say in business is to differentiate. It is so important for you to know the population you want to work with and to do something that other people are not doing. And that's what they call differentiation. If you want to be successful, you have to differentiate. I knew earlier on that I wasn't a hospital-based physician. I wanted to be outpatient. I felt like that was where my value was going to be. And my value proposition was to offer something that was different from what was being offered years ago at that time. So in around 2003, 2004, I was like, what can I do that is different? Focus on the population that I love, minorities, immigrants, but also, provide services on the weekends, on the evenings, do something that other people were not doing at that time before we started having urgent cares and things like, walk-in clinics and so on then. And so it's that with that in mind, having a clear vision of where you want to go and what you want to do that really, helped me focus and, continue to do the work and the rewards, to see the rewards of the patients doing better. And also, I've had challenges. It's not easy. People see you and they think, oh, everything is all so good. There's nobody who is in business who doesn't know how difficult and challenging it is. First of all, as a woman, then, as a minority, as an immigrant in a country, you have to jump through a lot of hoops. How do you get lines of credit to be able to buy equipment, to see patients and so on? It's a constant struggle. But it's in knowing and being confident that what you're doing brings value and having a long view. I always tell people, I have a long view of medicine. If you have a long view and you know that the services you're going to provide will make a difference and not looking for the profit the next day, if you provide excellent services, people are going to come to you. In Nigeria, we say better market sells itself. So I don't advertise. Mm-hmm. I allow the services that I provide to make a difference in the lives of the patients that come in there, and they are the ones that bring others. And that's how I was able to grow. And it's been challenging, as far as how I learned it, honestly, it was organic. I didn't really go to business school. I read a lot. So, and I like to look at people who are successful. And also I have to say that I've had mentors and I've had advocates. And I always tell people, when you're looking for mentors or advocates for you, it doesn't necessarily have to be a woman, a Black person. My mentor was a white man who saw in me something that he felt was good. And he would guide me. He would come to me, would meet. He would tell me what was going on in the community, what I needed to do to reposition myself. And so having mentorship and having someone to look up to was so critical, for me as a young doctor then. And, so I would say that really helped me and to guide me over the years. And I'm going to give a shout out always to Dr. Lawrence Silverberg, who saw something in me and was my biggest cheerleader, pushing me and telling me to, get out of my comfort zone, liaise with people who were not like me. I have friends in all the communities. I would say, it doesn't matter. My specialists that I really form a collaboration with all over the world. They're white, they're Black, from everywhere, all over the Middle East, everywhere. And it allows you to get into different communities. I have to shout out to Dr. Daisy Opal, a radiologist who I work with. So it's very, very rewarding for me to be able to, use what I'm learning from other people, seeing what other people are doing, what is it that is working for them, and learn from them. You don't have to be jealous about anyone, and I think that's what holds back a lot of people. Envy and jealousy blocks your rewards. When you see someone who is successful, what I want to do is, this person is doing well, this group is doing well, this hospital is doing well. What are they doing to do well? That's all that comes to me. How can I use their lesson to improve on me? What is it that I can learn from them? So I usually will gravitate towards people who are positive, people who see, what I want to do, who I see I can look up to. And my whole thing is about learning. So I want to learn from them. how is it that you made a difference in your community? How is it that you made a difference in your practice? How are you surviving? That's what I ask them first. And learning from them teaches me to use those lessons to see how I can use that to implement whatever I have to do for my business. So that's really how, I started with my business, growing my business and learning from there. And also I've had setbacks, medicine in the United States.
Talk to us a bit about setbacks you've had or challenges and how you've navigated that. You don't even have to go into too much detail, but just, kind of give us a flair for how challenging it has been and how what helped you, whether it's mentally, whether it's people around you to get through that.
So medicine in the US, you get very good clinical training, but you never get training about the business of medicine. And one of the things I didn't know at the time was that anything that is done in your office, even if it's done by a contracted entity, actually comes back to you, and nobody is told that. We don't learn what they call billing and coding. We don't. We basically contract it out. We don't have classes. We are not trained in that. You only learn that when you go into practice, and then you're taught here and there, one class here, one class there. It's not really a comprehensive training on that. And that is so, so important. So what I learned, I learned by myself, through self-help books, looking at, working with different billing companies and so on. And I had challenges where a billing company actually came in and was billing wrongly, and of course, this was a contracted entity. And what ended up happening was I ended up having to be the one to bear the brunt of it, to be the one who had to refund money because they did something that was wrong. They used the wrong coding. But what did I do with that? It was a very difficult time. It taught me a lot. But I spoke with my father and he said to me, NJ, when you have this challenge, what do? There are two ways to look at challenges, or what you call failures. Now you can learn from it, or you can recall back and be defeated by it. And I think a lot of times when people face challenges in their life, the first thing you want to do is to retreat, Wrong but no, way. What you need to do is say, this happened. What can I learn from this? And how can I navigate this to make things better? And it was so important for me because guess what? My son was a physician and I needed to know more. So what I did was enroll at Cornell, at the Johnson School, to do an MBA so I could learn more about the business of medicine. And then in the medical school in New York to learn about health policy. What are those drivers that we have here that I can learn from? And how can we influence it as physicians? Because you can be a doctor, you can get all these degrees, but how do you get politicians and policymakers to change, to actually see that what those policies, or to implement policies that help you as a practicing physician and help your patients? And so that's why I went to business school. And then I as I did that and explored that, I said, this is not something that I need to use just for the United States. I need to use this global. So that's why I enrolled in the Harvard program and completed the certificate in global health as a global health leader, and learning from so many wonderful and talented individuals. And I will tell you that this really helped me, so you need to look at failure. For me, what it taught me is whenever you have a challenge or failure, whatever you want to call it, you want to look at that and use that to actually catapult yourself, as we say in Nigeria, to something even better. How do you use what has happened to you for the greater good? And so there's so many physicians who have gone through challenges in their practice, and the first thing they do is, they don't want to practice medicine and so on. But no, you have spent so many years doing this. When you have a challenge, do not recall back. Look at what you have learned from that challenge, and see how you can use that to improve in what you do. And I learned so much about different companies in the business school that failed and actually risen and done better. You learn a lot. It was so good to be back in an academic setting to learn from other individuals. My classmates, all of them at Cornell, were wonderful in helping me navigate, the business world. And to see, it really taught me about how you can make a difference in your community, how you can use the knowledge that you have to improve the practicing life of physicians. So I'm so, you hear a lot about physician burnout and so on. I love what I do. And I want other physicians who are there to also love their specialty. So how can we improve the practice climate of doctors? How do we get other physicians to love what they do and they're not moving to other occupations? Is by making sure that when they practice, that they feel valued, that they feel included, that they feel, that their work situation does not cause them what they now call burnout, making sure that they get paid for the work that they do, So for me, it's really got me into digital technology and trying to see how we could use technology to improve practice, the practice patterns and workflows for physicians, because that's really what really bothers us. We have to go back home and chart, and spend hours instead of hanging out with our spouses and children and friends and family. We're doing work at home. So what can we do to improve, the practicing life of physicians, whether it's the front office work and back office work? And I talked before about using, digital or virtual receptionists. But we use technology for scribing, using AI. AI has been so helpful in helping, us reconnect with patients, because when you're on the computer typing what a patient is saying, you're not really engaging that patient. The patient it's as if you're more engaged with the computer. You're doing what you have to do to show that the patient came in. But patients don't really value that. And working with immigrants and minority, you really need to be there. They have to feel your presence. So AI has been so helpful, using AI scribing, so you have your AI on when I'm seeing patients and I'm talking to them, and it's able to actually recreate the whole visit for me. And, I'm old now, so typing is not my, my forte. And so, this really helps me type up the whole visit. It captures everything. So for me, I think that doctors should embrace, technology and use it to augment the work that they do. And this is really what I've really gotten involved with. So I'm really working at the intersection of health technology as well as medicine, advising some startups on what they can do, what they're bringing to, creations and innovations that can help physicians in their practice, and it's nice to be able to be a consultant to these startups, because I believe that it's only when you have a practicing physician who is actually doing the work that you can actually have them do innovations that really matter, that really move the needle in the right direction. There are a lot of innovations that are coming out in technology and health technology, but a lot of times they don't really meet the needs of the people who are using them. So being a physician who can advise these startups in what they're doing has been very rewarding to me, because I know that with what I'm doing, and the work that I am providing for them, the advice, the consultation, the end product will be something that is definitely will be more useful to other physicians in their places of work and help their workflow, whether they're in the hospital system or outpatient. So it's really been amazing. I'm now a digital technology, lover. I love technology.
I can see that.
It's like my passion, how can we digitize this? Everything is, how can we create something to make it better? And I think it's also nice because with technology, you can immediately see what impact you're making. You can quantify it. It's very measurable. can use the data you have to actually, show whether you're trying to get a line of credit or you're trying to get more grants or whatever to do your work, to show the impact of what you're doing. So there are parts of technology that we, of course, have to monitor and manage, especially AI, and make sure that, communities that we serve are, that whatever is being done is addressed, but for the overall, I think that technology in medicine has been, really, really revolutionary in trying to help us improve, practice, and also help us with improving access to care. Now you can do telemedicine and see patients in Nigeria and, Ghana or Liberia, and help those physicians manage those patients where, we know that we have a shortage of physicians and providers all over the continent. With technology, we are able to make an impact and help save lives of people who are on the continent without actually being there. So you don't have to do a medical mission to be able to help a physician group, whether it's in Liberia or in Sierra Leone or Ghana or Nigeria, to change and improve the work that they're doing to help patients there. So, and to actually be an advisor, and you can do this, in real time. And so it's very rewarding to me.
Wow. And Jay, that's, you've really touched on so much. And I think listening to you is just so inspiring. I want to ask you a question. I know we're almost coming on to the hour. I want to ask a question about using AI during consultation, especially with minority groups. Have you found any form of resistance? Do they hesitate? Do they get concerned that you have AI recording what they're saying? How has that been?
I mean, actually, it's been embraced because I think, first of all, you really have to let them know what it is. People get very worried when they think that, they're being recorded or you're using technology to record them. But it's in really, explaining what you're doing. So we start off by, really informing the patients about what we're doing. And, once they see it and once the note is done, I can show it to them. They can read it. They're just amazed, because it allows me to actually be more present during the office visit. Yes. So, I know that a lot of minority patients, have reservations when it comes to technology and AI and so on. But honestly, it's in how you explain it to the patient. How is this going to bring value to that patient interaction during that? And they can see, because I have it on and I'm just, talking to them, chatting to them, and getting their history. And it's been very helpful. At the end of the visit, they can see what the end result is. They can look at the encounter and see whether there's anything they want to add to it or remove from it. And so it's just being transparent. I think when you're not, that's where it creates a problem. Yeah. So it's been embraced wholeheartedly by our patient population.
Yeah, thank you so much for sharing that, because I think the point you raise about speaking to them, communication is so important. I always say when you communicate, the emotional brain calms down. So even if they were worried before, it just calms them down, and then they're able to really talk. They're able to really, instead of being worried about, oh, what are you recording? What am I going to say? What I need to be careful what I'm saying. That way, they're not actually telling you exactly why they've come, and you as well cannot be present and listening to them. And I think it's just fantastic that you shared that. But that key point of communicate with them, just communication is so powerful. And see, there's just so much you touched on that I just love. The challenge you went through, but how you dealt with it, how you deal with those challenges is just incredible. And it's a lesson for everyone listening that when challenges come, what do you do? Do you freeze? Do you run away? Or do you stop and process it and learn from it and move forward? And what you did is just incredible. You decided to actually go out and learn and equip yourself, empower yourself, and come back and then gave birth to Summit Medical Group, which is just incredible. So honestly, NJ, it's a pleasure really chatting with you. And I want to touch on two things before we finish. You talked about a mentor. And I think my question is, did the mentor come to you? Did he see something in you, or were you the one that actually reached out to him to mentor you? How did that work? How did that start?
So my mentor was a professor in my program during my residency. And during that time, we formed, I was very interested in learning about outpatient practice and what we could do. And I saw that the way he was teaching me and the things he taught us as residents was something that I really wanted to emulate. So I reached out to him and I said to him, I would like to learn from you. You are someone who, embodies the kind of doctor I would like to be. And he was so, happy to do that. So we met for lunch and we talked, and then I went to his practice. I worked with him several times during my residency training program, and we developed a relationship over the years where he led me and helped me actually start my practice and build my practice. So you have to reach out. You have to look for someone who inspires you, who's someone who, you want to be like, somebody who really creates those positive moments in you and has a vision, that you really want, to have. Is there someone in your life that you can look up to say, I want to be like this person, and reach out to someone around you and see whether they can mentor you? So I did reach out. And it's been a wonderful relationship over 30 years. And he's been by my side through every single thing that I've done and introduced me to so many people, has been very helpful. We're through the ups and downs of business and practice. And that's what people need. You need somebody who is an advocate for you, who will be in that room when you're not, who will speak up and tell people the kind of person you are. And it doesn't have to be someone who is from your town, your village, this is a white man that helped me. So it can be anyone, someone who embodies who you would like to be like. So, and someone who inspires. So, that's how I met Dr. Silverberg.
Yeah, no, that's amazing. You were proactive. You reached out to him. And I asked that question because a lot of times people sit back waiting for someone to come to them or hesitating from doing something. But you've got to be so proactive and reach out to people. And like you said, it doesn't have to be someone that looks like you. Could be anyone, someone that has, that you see something and that can help you. Thank you so much. The other thing I want to talk about, probably the last thing before we go, is I want to say congratulations, Njide, congratulations, because you are a multiple award winner, and it's a lot of it as well, apart from the medical side, is the philanthropic work you do. You do so much. You give so much back. Even listening to you in terms of the digital work you're doing in Nigeria and Africa is incredible. How you really, bring people up, train people, bring people up. And you got an award recently, because I remember seeing it on LinkedIn, and it was the Philanthropic Award from the Center for Social Awareness, Advocacy and Ethics. And it's, I know from talking to you, it's something to do with really helping to empower people in terms of leadership and a lot. But talk to us a bit about some of the philanthropy work you do, because you do so much and it's just incredible. And it just goes to show, it's sometimes I'm listening to you or watching you and I'm going, where does she get all this energy? But the good thing about you is you work hard and you play hard, because that is so important. Yeah, go on.
Yeah, sorry about that. Yeah, I think you have to have a balance, right? I work really hard, but I also take time out for myself, and my family. I take time out for myself and my family. I love to travel. And so I like seeing new places, visiting, relaxing, being with family. So there has to be a balance in your life. Otherwise, you're going to be burnt out and you won't have anything to give. So you have to retool. So I certainly do that. And one of the things that I love is really working with nonprofits that embody, my values. And the Center for Social Awareness, Advocacy and Ethics is an organization run by Catholic priests. And the founder is a Catholic priest, Father Godswill. He's Nigerian. And everything, when he talked about founding this organization and what he wanted to do, I was 100% behind him. I'm like, you got to do this. We have to do this. We have to help the youth in Nigeria. We have to do things to help young people. They are our future. We're going to get old someday. And so I've been working with them over the years, supporting them financially and otherwise to get to where they are today. And also there's another organization near and dear to me that was on their board, Luminous. It works with immigrants in the Howard County area and beyond. And so, I do a lot of work with nonprofit organizations that really embody what my values are and try and support them. And I always tell people, supporting an organization is not just about money. It's also about, you can give of your time, right? Advice. Yeah. You can give them connections. You can help in so many different ways. It's not just, I don't want to help because they're going to ask me for money. There's so many things you can do, to help organizations that really bring in value to improving the world that we live in. So, so that's, I don't even see it as work. It's so nice to be able to, help these organizations survive and thrive so that they can continue the work that they do, because it really helps us. It helps us globally, it helps us, wherever we are. When you have nonprofits that are doing things that are necessary to make life better for us as citizens of the world. So I just look out for those kinds of organizations and I try to support them as best that I can. So that's really what my life's work and what I do on the side. Yeah.
Oh, NJ, you're an incredible woman, incredible friend, incredible sister. I'm so honored, and thank you so much for taking time out to come and spend this time talking to me. Because it wasn't long I asked you to do this, and you said yes. I'm in. Thank you so much. I really do appreciate it. One thing that I'm just going to say again, something you said that I think I want to reemphasize for everyone listening, is that concept of differentiate. When I asked NJ about what really drives her, how did she get to where she is today? How did she manage the challenges? And one of the things she said is differentiate. Differentiate, do something other people are not doing. Look for, differentiate yourself. Do something different. Look for those things, look for where there's a need and create the solution. Thank you so much. And you've really shown that throughout your life. And I think your life is a good example of the importance of what parents sow into children's lives. Because when you sow that, it then comes out. And I'm so honored to really to know you and for you to come onto this program. And I'll say congratulations once again for the awards and for what you're doing. Can you now just end this podcast by just leaving one great, word or advice of wisdom for our listeners? You have given us so much, but just the last one so that we will take away with us.
Yeah, thank you so much for having me. For everyone listening, I will say, that you have only one life to live. Make a difference.
Make a difference. That's a good one to end it. Thank you. Thank you so much, NJ. Thank you so much. I really appreciate you.
Yes.
And listeners, remember, please subscribe to this podcast and share. Njide has left so much with us today. She's really opened herself up and given us so much nuggets. So I look forward to seeing you all catching up again and being with you in our next episode. Thank you for listening.